Today at the Olympics, Kevin Fiala is stretchered off of the ice. Hi there, my name is Dr. Stephen Wilson, and here on this channel, we analyze the science of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. Near the ending of the game, it's on this play here that Tom Wilson goes into the boards to engage with Kevin Fiala of Team Switzerland, and their legs happen to get a little bit tied up on the play. In this frame, we can actually see Tom Wilson's skates. Both of them have completely left the ice, so he is actually somewhat airborne in this moment, and he's going to come down, and you can see there's the outline of his bum, and it's going to come down onto the backside and the outside, the posterior and the lateral side of Kevin Fiala's skate. I'm going to outline Kevin Fiala's lower leg and his skate, and we can see how Wilson is going to make impact down on the backside of Fiala's leg. And we can see that occurring here. Again, that's Wilson, and that is Fiala's skate coming down on the backside, the outside, the posterolateral aspect of Fiala's lower leg. That's going to force his foot to turn outwards into external rotation due to the pressure from Tom Wilson's his entire body weight coming down on the back of Fiala's leg. That's going to lock his talus bone in place, and with the increased mechanical stress of Wilson's his body weight forcing his foot to the outside, that's going to be a tremendous amount of stress directed straight through Fiala's left fibula and his lower leg. But in addition to this, now remember, Fiala's foot is on the ice and Wilson's coming down on the backside of his leg. That is also going to stress Fiala's knee. When you forcefully move your tibia and your fibula, your lower leg, forwards or anteriorly relative to your femur or your thigh bone, that is going to place a direct stress on the anterior cruciate ligament of Fiala's knee. And after Wilson lands on the back of his leg, we can see this is the outcome. Fiala he's face down, he's in the prone position here on the ice, and we can see how much his left skate is turned into external rotation, his entire leg, due to that body weight of Wilson coming down on him. From here on the different angle, again, we can see Fiala's leg forcefully turned outwards in external rotation due to that stress through his lower leg. As we advance through the frames here, we can see the athletic trainer of Team Switzerland is now on the ice responding to Fiala's injury. He's making a fists with both arms, and he's crossing his wrists. That is their signal, their manual signal to trigger what's called their EAP, their emergency action plan. The athletic trainer is signaling that he requires assistance on the ice. That means all personnel will now converge to the ice surface, including Team Switzerland's doctor and the emergency services with the stretcher, in order to remove Kevin Fiala safely from the ice surface. After that signal has been made and the EAP is activated, here are the personnel, including the Italian-style stretcher, all responding to the ice surface to help with Kevin Fiala. In this frame here, we can see Fiala. He's actually face down on the stretcher in the prone position. And I'll draw the outline of what they're using to help to stabilize his left leg in order to reduce joint motion. Usually when that occurs, they're able to detect on the ice some sort of joint or leg instability. That is the reason for using the splint to help restrict joint motion in Fiala's leg. And we can see where it is. It is below his knee, just on the lower leg on the calf portion of Kevin Fiala here. He will be transported to a local hospital. He'll undergo diagnostic imaging in order to determine exactly the extent of injury that he sustained on this play. Now, again, they're probably going to be looking at two different areas: his lower leg, most likely his fibula, possibly even his tibia for a fracture in that area, and his knee, checking the structural stability of the soft tissue ligaments that hold his knee joint together. When we use the anatomy screen here, we're going to look at the skeletal bones here of the lower leg, And we're going to orient ourselves from the left lateral view. So we're going to pretend this here is Kevin Fiala's lower leg. Remember, Tom Wilson's entire body weight came down from this direction onto the backside, the posterior lateral part of Fiala's leg, driving his tibia and his fibula forward in this direction relative to his femur or his thigh bone. And that forced his left foot to externally rotate, which is going to place a lot of stress on his ankle joint itself. It's called the talus bone. It's going to lock into position. And the added stress of the entire weight of Tom Wilson coming down on his leg is going to force it to externally rotate into what we call the closed packed position, and it's going to stress beyond that, which often results in a fracture through the fibula. But with this much stress, even his tibia could be in danger of a fracture on the play. And as I mentioned before, that will also place a fair bit of stress onto his left knee, mainly through his anterior cruciate ligament, his posterior cruciate ligament. They will all be pushed anteriorly, possibly beyond their normal physiological range of motion, which could result in a significant knee injury on this play here. Kevin Fiala will be assessed at a local hospital for any or all of these injuries that I outlined here. Hopefully he is doing well, and we wish him the best of luck. I hope we learned here something tonight. Thank you very much for watching, and please be well.